Hi everyone, thank you for joining us today to continue with our Alzheimer's video series. If you haven't checked out the videos in the past, please feel free to do so. We talk a little bit about general information about Alzheimer's and talking a little bit more about the Bredesen protocol and the 6 different types of Alzheimer's that Dr. Bredesen has identified. Today in particular, we are going to be talking a little bit more about vascular type of Alzheimer's. So when we think vascular, blood vessels, veins,
heart, we tend to
exactly.
think of the most obvious, like people having heart attacks, we think of heart disease. We don't tend to think of vascular in our brain.
No, not really.
Although definitely there's certain things that can happen to our brain where we don't get enough blood flow. Like, I think we've all heard of people having a stroke before, and you can see just the effects of not having the blood flow to the brain. It's cut off, and you can see immediate changes. But again, most people I think would think of like heart attacks and such. But definitely vascular issues of the brain can impact someone's health significantly.
Yeah, and something that you said made me think of a question. So you were talking about kind of like those immediate effects that you can see with a stroke. How does that compare to the vascular type of Alzheimer's? Is it also kind of a more immediate thing, or is it something that you see?
Yeah, it's definitely more of a long-term, slow process that's happening inside someone's body, but it's because of the vascular issue. So they may see that the person does have some vascular things going on, like they may have a history of strokes. And so we definitely know of people that have had strokes that almost immediately they lose their memory.
Right.
And that would not be Alzheimer's disease, though, because Alzheimer's disease does not happen like instantaneously. Because again, we have to have those amyloid plaques and those neurofibrillary tangles. If we don't have them, it's not considered Alzheimer's. It's still a problem, and it's still a bad thing to happen to your brain, but it's not Alzheimer's disease. So it's really over time, either due to like strokes, and there's different types of strokes that a person can have. A person can have a stroke where something blocks the artery, or they may have a stroke where the artery actually spasms and it blocks blood flow into that part of the brain. Or they may have it where the blood vessel actually like gets like a hole in it, like an aneurysm, and then they start losing blood flow to a certain part of the brain. But it may not be strokes at all. It may be just that they have arteries that don't have good blood flow through them. So like that clogged artery that we tend to think of, that may be the issue, and that decreases blood supply to parts of the brain. And if it's if the body goes into that protective mode, it starts to try to protect itself by developing those amyloid plaques and neurofibrillary tangles. That will be vascular Alzheimer's disease.
Okay. So from everything that I've heard so far, with it being very tied to stroke and vascular, those are all things that sound to me like diet and lifestyle can play a huge role in preventing. So would you say that that's a big component of minimizing risk for this type of Alzheimer's?
It definitely is, and I think the people need to understand that needs to happen early on in life. They talk about heart attacks don't develop overnight. They start in people's teens. That's the same with other vascular health. It starts as early as people's teenage years. And so the things that if people really want to be working on preventing Alzheimer's disease in all the different areas, all the different types, but especially with vascular, they need to start at an early age. It doesn't happen like, hey, I'm 60, 70 years old now. Probably a good time to start thinking about making sure I'm getting good blood flow to the parts of my body, to my brain especially. So those are things that need to happen from an early age, not something that happens later on in life. Now that being said, the nice thing is because blood vessels have direct blood supply, is they can heal pretty quickly. So you can make changes. So even if a person did decide at 60, 70 years old, hey, I need to take care of my blood vessels, they could start doing that at even that later on age in life.
Okay, good. I'm glad you pointed that out, because I was sitting here thinking like, okay, so if you need to start this in your teens, like what about people who are tuning in who are in their 50s or 60s, like is hope lost? And it sounds like there is still definitely a lot that they can do. It's never too late to
It's
make
not,
those
and
changes.
even if a person's been diagnosed with vascular and Alzheimer's due to a vascular issue, there's definitely things that those people can be doing that would help to reverse it. And so it's not, there is hope still for that.
Yeah, and I know that with a lot of those preventative measures that we've talked about, like we'll say diet and lifestyle, but we do talk a lot about diet. This one, just from what you've said with blood flow and how important that is, like, can we touch on exercise at all with that? Like, how big of an impact
so exercise is
can
going to play a huge part. So we think of different types of exercise. So we think of weight training, and we think of CrossFit type of training, kind of high intensity. But we also have heard of cardiovascular training, and so that's that longer term exercise, and that definitely has been shown probably to be one of the most protective for getting blood flow to the brain anyways.
Yeah.
And so it doesn't have to be you have to become a marathon runner. It can be literally going for walks on a daily basis that can be helpful.
Yeah, kind of the new saying that I hear a lot of is that sitting is more dangerous than smoking.
Yeah,
right?
Absolutely. So sitting is just bad for so many different ways. It doesn't get the brain moving, or brain firing, I should say. Doesn't get that blood flowing, doesn't get the neurotransmitters firing. So sitting is really hard on our body, but again, to look at exercise, moving our body is probably one of the most important things. So I can go exercise really hard for an hour and then go sit on the couch for the next 17 hours in a day. And that's not going to be as effective as if I was to just keep moving throughout the day.
Right.
So it's really important that we realize, what is exercise and what is really healthy for us. One of the other things that we need to take in consideration too when it comes to those lifestyles is we all have genetics that we have to work with.
Yeah.
And we definitely can't change our genetics, but there are genes, and we've talked about this a little bit in some of the previous videos, but there are genes that we can do things that would turn those genes on and on. Or there is also some genes that if we just knew that we had that genetic issue, we could work harder than say someone else. And one of those would be people that are dealing with methylation issues. People that have methylation issues, what can happen is they can develop a buildup of an amino acid called homocysteine.
Okay.
And the problem with that is homocysteine has been compared to like these little ninja knives that, as they go through your blood, they cause damage when they go through your blood vessels. They cause damage to your blood vessels.
Okay.
And so then what will happen is cholesterol will come to try to heal that blood vessel. Cholesterol gets easily oxidized, and now you form a plaque. And so having high levels of homocysteine is crucial to some of the plays a huge part in developing vascular problems. And so being able to lower that, knowing that you have that is important, because if you don't know that you have it, you wouldn't even know that you should do something different.
Right, so how would someone find out for sure that they have
very,
it? Is
very
it
simple
just blood test?
Yep, and it's not, you can literally ask, when you get your routine blood test for a physical, you just ask the doctor, can you add homocysteine to it? So I don't know why they don't just make it routine, but most doctors will just add that to that test, and you can find out if it's high or not.
Okay, interesting. Any other different indicators that people should be keeping their eye on? I mean, obviously, if someone has a history of stroke or something, that's going to be a big one, but any other more minor things that might be an indication of like, okay, you might want to start doing something about this?
Yeah. Some of it's going to be just looking at your own lifestyle. You know, if you're not exercising, that's a pretty obvious one. You know, if you're not eating right, that's a pretty obvious one. But there's definitely some things that I think that people don't really think of when they think of poor vascular circulation. So some of them can be people that develop like toe fungus.
Oh, interesting.
They just think, oh, okay, that's just random. Why did I get toe fungus? Well, a lot of times it's because you're not getting enough blood flow. Erectile dysfunction is another one. That's another sign. So these are kind of our extremities, and our brain can be considered an extremity. So if we're seeing that we're getting bad blood flow to our extremities, our hands and our feet, then we're probably going to be having that going on with our brain too. And our brain makes up about 2% of our body weight, but it really takes up about 20% of the energy that we use. So
wow, that's a
it
big difference.
It is, and so we really, our brain needs a lot of blood flow.
Mm-hmm.
And if we're not getting that blood flow, then our brain's not going to work the way it's supposed to. And then if someone's prone to Alzheimer's disease, they can develop Alzheimer's disease because of that lack of blood flow to the brain.
Yeah, wow. Well, you have already covered all of the questions that I have for you today. Is there anything else that you wanted to share before we wrap up the video?
I think that the last thing, and I've mentioned this in other videos again, is just the reason we're making the videos is because we want people to realize that there is hope.
Mm-hmm.
Again, I think that people have these certain diseases that they've been told that, well, there's nothing really that you can do about it. You've got the disease, so now you just gotta let it run its progression,
Right.
and maybe we can give you some meds that can slow down that progression, but that's as good as we can get. And that's just not true. When we look at, there's lots of studies out there now that are showing that there are things that can be done. There's definitely things that can be done before someone develops Alzheimer's that can help with vascular health. And there are definitely things that have been shown through Dr. Bredesen's clinic that he's worked with over 1,000 patients, seeing improvement in people that have full-blown Alzheimer's disease. So
Right.
there is hope, and
Yeah.
we don't want to give false hope, but because of what we see in real life experience in Dr. Bredesen's clinic, we can see, and we've seen it here in our office as well, that people can see improvement. And
Yeah.
that improvement for some people might be literally just they can't dress themselves, and now they can dress themselves.
But that's huge
It
for
is
someone
huge.
who's at
If you're
that
a
point.
caregiver and you're trying to take care of someone and you're having to dress them, or you kind of constantly feed them, and now they can
Yeah.
feed themselves,
That's a big difference.
it does make a very big difference. But for what we've also seen that some people have had complete reversal where they couldn't even get out of a chair, and now they're working again. So it really depends. We never know how that person's, how much improvement they're going to see, but there can be improvement, and that's the key. Is
Yeah.
that there is hope.
Yeah, and so that's where it would really take them, they would need to find a practitioner who is versed in the protocol to be able to
Absolutely.
kind of figure out what needs to happen
Yeah,
next.
trying to do it on their own, I think, would be pretty hard with someone with full-blown Alzheimer's. People that are just looking to prevent, there's so much they can do on their
Yeah.
own, which is why we're making these videos.
And we will be making a video with more general tips on preventing,
Yep.
correct?
Absolutely.
Okay. So thank you again for tuning in today. Stay tuned for those other videos, like we said, about how to, like general tips of how to prevent or decrease your risk of Alzheimer's. Appreciate you being here today.
Absolutely.
And
Love it.
if there's anyone that you know that might benefit from these videos, please feel free to share them, send them along so that other people can receive this message as well.